All right, everyone, welcome back. Today we're going to be taking a deep dive into something that's pretty relevant to, I would say, almost everyone at some point in their lives, and that's dental implants. But we're going very hyper-specific today and focusing on a component of dental implants that you might not even know exists, and that is called the dental abutment.
Yeah, abutments are interesting. They're kind of like the unsung heroes of, I guess you could say, the implant world. They don't get a whole lot of attention, but without them, implants just wouldn't work.
Exactly. And for our deep dive today, we'll be referencing an excerpt from an article simply titled Tasted Text. And, have you ever, lost a puzzle piece and then the whole puzzle falls apart? Abutments are kind of like that crucial piece that connects the implant, which is embedded in your jawbone, to the crown, which is that part that you actually see when you smile and use for chewing.
Yeah, that's a good way to put it. The abutment actually influences how the gums heal around the implant. So it's not just connecting, it's making it look and feel more natural.
So there's like an artistry to it. It's not just like screwing things together. That's pretty cool. Makes me think, though, are all abutments the same?
Not at all. Think of it like this. If you were building a house on a hill, you'd need a different foundation than if you were building on flat ground, right?
Yeah.
Well, abutments, they come in all different types and angles to fit, the unique structure of everyone's jawbone. The article mentions prefabricated versus custom-made, straight versus angled, and there's a lot more we can get into.
Okay, so there's definitely some engineering involved there. And what about the materials used for these abutments? I'm picturing like metal in my mouth, which doesn't sound very appealing.
Yeah, you're not wrong about the metal. Titanium is a common choice. It's super strong, and, the body generally tolerates it very well. But there's also zirconium, which is a ceramic, and that's usually preferred when aesthetics are a top priority, especially for front teeth where, they're more visible when you smile. The excerpt even mentions a newer polymer called PEEK.
Peak. That sounds like something out of a futuristic dental spa.
It might sound futuristic, but it's gaining popularity because it's really lightweight and blends in well with the natural color of your gums. Plus, it's biocompatible, meaning it's less likely to trigger any, adverse reactions.
So if I'm someone who's, say, worried about metal showing through or has like a sensitive mouth, this peak material might be something to consider.
Exactly. It's not a one-size-fits-all situation. Like everything else we're talking about, each material has its own advantages and disadvantages. For example, while titanium is really strong, it's not always the best choice for folks with thin gums because it could become visible. Zirconium, on the other hand, offers a more natural look, but it might not be suitable for every situation, because of its strength.
Okay, this is making me realize that getting a dental implant is a lot more nuanced than I initially thought. So how does the abutment actually get put in place? Is it a whole separate procedure?
It really depends on the approach that your dentist decides to go with. The article pasted text. It outlines a couple of different methods. Let's start with the two-stage approach. That's probably the more common one.
Okay, two stages. Does that mean like two separate surgeries? I'm already getting
Oh,
nervous.
no, no, no. It's not as scary as it sounds. So in the first stage, the implant itself is placed into the jawbone, and then it's left to heal for a few months. And this allows, the implant to really fuse with the bone, creates a really nice solid foundation. And then in the second stage, the dentist performs a minor procedure to expose the implant and attach the abutment.
Okay, so the gums have to heal twice. Once after the implant and then again after the abutment. That makes sense, but it does sound like kind of a long process.
Yeah, it takes a bit longer, but those healing periods are crucial, for long-term success. The article emphasizes how important these periods are to allow the tissues to integrate properly. And really prevent any complications down the road. It's like if you were building a house, right? You need to let the concrete set before you start building walls on top of it.
Right, yeah. Okay, I'm starting to understand the importance of those stages. But what about that one-stage approach you mentioned earlier? Does that literally mean just one surgery?
Exactly. In the one-stage approach, a temporary healing abutment is placed at the same time as the implant. And this eliminates the need for that second surgery to expose the implant. It could be a really good option for people with, good bone density, good overall health, and also for those who want a shorter treatment timeline.
So it's like a shortcut, but not everyone qualifies.
You're exactly right. It's not for everyone. Your dentist will ultimately determine the best approach for your specific situation.
Got it. So let's say I go through the procedure, get my new, shiny abutment, and everything's all healed nicely. What happens then? Is there the special care involved?
That's a really important point to bring up. The article really stresses the importance of aftercare. You'd think, since implants aren't natural teeth, that they don't need that much attention. But actually, the opposite is true.
Oh, interesting. So I can't just, get my implants and then just forget about them.
Definitely not. Caring for your implants is essential for their longevity. You've, spent the time, the money. Think of it like an investment. You want to protect it.
Yeah, for sure. So what kind of care routine are you talking about?
Okay, so the basics. They're pretty similar to caring for your natural teeth. Brushing at least twice a day, flossing every day, and using an antimicrobial mouthwash. But there are some implant-specific things to keep in mind as well.
Like what?
For one, you want to be really gentle around the implant site, especially during that initial healing phase. Use a soft bristled toothbrush and avoid anything too abrasive. You want to clean everything effectively without irritating the gums or putting pressure on the abutment.
Okay, that makes sense. Soft bristled toothbrush, check. What about flossing? Is there like a special technique or something?
Flossing is super important, to remove plaque and food particles from those hard-to-reach areas around the implant. You can use regular floss, but there are also these special floss threaders that are designed specifically for cleaning around implants and under bridges.
Oh, wow. I didn't even know those existed. See, this is why I love these deep dives. You learn something new every time.
I'm glad to hear that. Oh, and one last tip. Don't forget about those regular dental checkups. Your dentist will want to monitor the health of your implant and address any potential issues as soon as possible. They have special tools to examine the implant site just to make sure everything looks good.
It seems like those regular checkups are just as important for implants as they are for natural teeth then. All about prevention, right?
Exactly. Regular maintenance is key to keeping those implants healthy and functioning the way they should for years to come. The article even mentions that with proper care, dental implants can last a lifetime.
Wow, that's great to hear. So we've covered different types of abutments, the placement procedure, and the aftercare routine. Is there anything else we should know about these little wonders? It does feel like we've covered a lot. But I'm wondering, about the long-term outlook. The article mentioned that these implants can last a lifetime. Is that true for everyone?
Well, it's not quite a set it and forget it situation, unfortunately. Just like anything else in our bodies, implants need that ongoing care, and there are factors that can influence how long they last.
Okay, so besides like the super meticulous cleaning routine that we talked about, what else could impact the, lifespan of an implant?
Well, one big one that the article touched on is smoking. Nicotine reduces blood flow, which is super important for healing and maintaining healthy gums. And because of that, smokers generally have a higher risk of implant failure compared to non-smokers.
So it's not just about like staining your teeth. Smoking actually affects the implant itself.
Exactly. It's like, trying to grow a plant in poor soil. The implant needs a healthy environment to really thrive, and smoking really compromises that.
That makes sense. Anything else we should be mindful of?
Yeah, diet plays a role too. Think about crunching on ice or hard candy, that kind of force. It can put a lot of stress on your natural teeth. And it's even more important to be mindful of this with implants.
So no more chomping on popcorn kernels for me.
Probably a good idea to avoid those, especially during those early stages of healing. Your dentist will give you, specific guidelines on what to eat and what to avoid.
Got it. And speaking of dentists, I'm assuming those regular checkups are crucial for catching any problems early on.
You got it. Regular visits are not like getting an oil change for your car. It's preventative maintenance. Your dentist will look at the implant site, make sure there's no signs of inflammation, infection, any loosening. They'll also check the surrounding teeth and gums just to make sure everything's in harmony.
So it's really not just about the implant itself. It's about like the overall health of my entire mouth.
Exactly. Everything's connected. A healthy mouth will support healthy implants and vice versa.
Well, this deep dive has been super eye-opening. I never realized there was so much involved with getting a dental implant, let alone the role of this, tiny but mighty abutment.
Yeah, it makes you really appreciate how much goes on behind the scenes of a seemingly simple procedure.
It really does. Makes me appreciate the skill and expertise of these dentists even more.
Absolutely. They're not just fixing teeth, they're restoring function, aesthetics, often, confidence.
That's a great point. So for anyone listening who might be considering dental implants, what's the one key takeaway you would want them to remember?
I think the biggest thing is just to do your research, ask questions, and find a dentist you really trust. This is an investment in your health and well-being, so it's really worth taking the time to, make informed decisions.
Absolutely. Great advice. And on that note, I think we'll wrap up this fascinating deep dive into the world of dental abutments. We hope you learned something new today and maybe even feel empowered to take charge of your own dental health.
Until next time, keep those smiles bright and those pearly whites sparkling.